Hello and welcome to Talk of the Town. I'm your host, Christine Fenner. This show is about bringing you interesting events as well as interesting people throughout our community. And I'm very excited to introduce to you Drs. Elizabeth Pritts as well as David Olive.
Hi.
Welcome. Thank you for joining us.
Thank you.
So the first question I have for you is, when did you found the Wisconsin Fertility Institute and why?
So we founded that in 2007. And Dave and I had a vision that there was a clinic somewhere where it was great for the patients, it was safe, it was welcoming and warm, where the doc spent a ton of time with the patients, not just the hour at the initial visit, but they were doing ultrasounds, they were in there during their entire treatment, teaching them, helping them understand what was going on. Yeah. And we looked around the country and we couldn't find anything. And Dave and I love Madison, so we just decided to create our dream clinic here, and we did.
It's true. We wanted a place where people could feel safe in a fairly anxious environment.
Yeah.
It's difficult to go through infertility treatment, and because of that difficulty, we wanted a place where people could relax a little bit and feel like they could be in a safe place for once during their journey.
So tell me about some of the causes of infertility.
So there, about 45% of the time, there's a female factor that we can figure out. The female partner isn't ovulating every month. Her fallopian tubes are blocked. Perhaps her egg quality is starting to diminish. It's not the same as it was when she was 20 years old. About 40% of the time, there's a male factor issue. And I think the most difficult, 15% of the time, it's unexplained. And it's difficult for us as doctors because we want to find the thing and fix it. And it's difficult for the patients because they say, please find the thing and fix it, and we can't always do that.
What are some of the treatments available for infertility?
Well, the treatments depend a little bit on what the problem is. So if there's an ovulation problem with the female, then the treatment generally is to give medications of some type to fix the problem, to get the patient to ovulate on a regular basis. If the problem is anatomic in the female, surgery is oftentimes utilized. If the problem is in the male, it can be hormonal, it can be genetic, it can be anatomic, and all of those have very specific treatments. And if it's unexplained, then we take a different approach. The strategy there is to try and compress time, to try and create more ovulations more frequently, and also to put the sperm closer to where the eggs are. And that can be something as simple as artificial insemination or something as complicated as in vitro fertilization.
We see so many celebrities these days in their 40s and 50s having children. Is this normal to have this?
Yes, it's normal. So women and men, we're starting to wait until our careers are all set. We finished our education. We're in a great, stable relationship. Financially, we're ready. And oftentimes, it's too late for women. Our fertility potential starts to wane at 35. By the time women are 40, only 30% of us can create pregnancies using our own eggs. At 43, only 10% of us can. And so many of the women over 40 that you see having successful pregnancies are utilizing donor eggs or donor embryos.
Now, before the show, we talked a little bit about how you actually discovered that you needed fertility treatments. Tell me a little bit about your experience.
Yeah. Well, we got married. Elizabeth at the time, I think, was 36 or 37 years old. And we decided, you were 38,
yeah.
And we decided to have kids. And at that age, it's difficult. And we faced our own infertility problems. We tried virtually every technique that we currently offer. And we were unable to be successful. We tried up until the age of about 42.
This week is National Infertility Awareness Week. What do you want people to become more aware of?
Well, I think it's really important that they don't wait. That's the most common complaint that my patients have, and that was the complaint that I have. I waited until the quality of my eggs was poor, and then I was all of a sudden ready to go for it. So I would say don't wait, especially to see a fertility specialist. So if you know you have a problem, a male factor, the female partner isn't ovulating every month, then get in to see the specialist. For the female partner, if you're 35, get in to see the specialist. You know, insurance companies, they're not asking for referrals anymore, so you can come right in to see the specialist. And because it's all we do 7 days a week in fertility, we can be more efficient, we can be more cost effective, and quite honestly, we can be more effective to help treat infertility. However, once you're pregnant, we are no longer the experts, and so we send our patients back to the obstetricians.
Got it. Well, thank you so much for joining us today, and we really appreciated learning all about your practice as well as the National Infertility Week. So thank you for coming in. We greatly appreciate it.
Thank you.
Thank you.
And we'll be back in just a few moments with more Talk of the Town.